I would like to invite Professor Mahadevia.
Speakers in congratulating and thanking TIS as well as NIRD in organizing this webinar. The response seems to be quite overwhelming. There are a large number of participants now who have joined the webinar. Arvind has already corrected my affiliation, so I don't need to speak. I think on the poster I was announced as Center for Urban Equity Q at CEPT University. I moved out of CEPT about a year and quarter back. So before I come to the specific question that has been put to me, I do want to reiterate and take forward what Ravi stated in his opening remarks. One, that we need to relook at the issue of separating out the work and housing spaces in the urban areas. They actually, for many informal workers, work and housing go together, especially for those who are in the self-employment sector, and given that there's a lot of outsourcing of work happening since last almost 2 decades now. I also agree with the principles that Ravi laid out, and I am going to sort of take them forward in the urban context. Kannan did raise the issue of non-implementation of Unorganized Sector Act 2008, and many of us were very active in seeing how it would work within the urban context. And I think yes, all of us are disappointed by all the governments at the national level as well as the state level of not pushing this forward. Those who are familiar with the history of urban development and urban planning would know that every pandemic has pushed forward new ideas about urban development. I think we need to take this situation now and convert that into opportunity to re-discuss about what the cities should be, how the cities should be, where should the funding, where should the investments in the cities be, etc. In the coming months and years. I think there's been almost pushing out of the welfare agenda or people's perspective in the formal government-centered urban development agenda. For example, the most paradoxical situation now is that on the March of 20th, just before the national curfew was announced, a trial curfew was announced on 22nd March, the central government passed a self-indulgent project costing 20,000 crore rupees, which is redevelopment of the Central Vista. Now, one just questions how such decisions are taken. There's a huge amount of literature available in the media today on how this has happened, but the priority of what urban development does is very, very, in a very classic way, highlighted by the kind of decision that has happened. March 20, also there was a Gazette notification which changed the provisions in Delhi Master Plan. And for those who don't know, Delhi Master Plan is being redone from 2021 onwards for next 20 years. And so the decision to change the Delhi Master Plan has come external to the process of this kind of making the master plan. It has come from the top. And so this is how decisions of urban development has been happening. And I think this is time we need to take the whole urban development issue and look at it once again. It's not that these discussions have not been happening, but I think in this kind of pandemics, we need to relook at that. A lot of new urban institutions have come up, for example, after in the early century, last century, improvement trusts came up to address the issues of urban health and hygiene. And we have still continue to have in some states improvement trusts addressing or improvement trust act that are looking at urban development. other preliminary comment that I want to also make, that urban development itself, the way it has been conceptualized, even since independence, I mean, leave aside the British time, it has been heavily loaded against the informal sector and migrants. And if you read the early plans, they had said that the city's development should discourage migrants coming in and so on. So we have never paid attention to how the housing for the migrants, their water, sanitation requirement, this is basic hygienic requirement and basic health requirements are to be addressed. And so now to expect that the city systems will work in the time of pandemic is asking too much of a system that has never cared. I'm saying this in a general sense. Some states may have done better, but largely this is how urban planning has sort of worked till now. This pandemic has also highlighted in the current is that if you look at some of the data coming out of the cities of where the pandemic cases are located, and we find them to be located in segments, and that's why we are using the term hotspots. So for example, in Ahmedabad, it was in the wall city, which has been put under curfew, and then the industrial areas of the city. Or Mumbai, it is now Dharavi, which is coming out. Same thing probably is about Delhi. It's not just that, but the elites are panicked and sort of withdrawn in their enclaves. And there has been the segregating tendencies in the cities, spatially and now even socially. Hello? Which are likely to sort of aggravate. I mean, if you look at some of the WhatsApp group among the elite societies, you see that very, very clearly. So what we need to do, and it's also not the Social Security Act that is one had worked very clearly closely with the UPA government, but we were also involved in a comprehensive urban housing program at that time, and that we had proposed that there is no one-size-fits-all approach to addressing housing question of the urban poor, because urbanization is a process which is in a sense uncertain. Constantly people are coming in because urbanization is an outcome of migration largely, and our rates of migration being low, our urbanization rates due to migration is also low. And given the nature of our economy, a lot of work is getting generated in the informal sector, and in that context, how do we address the housing requirement? Because housing requirement is the aspect which has to be, it's a center point of any social protection issue. When we were doing this research on social protection, we had put that basic housing to be put as a part of the agenda of minimum social law. Now this is also an opportunity to sort of look at if we can address the question of food security in particular, or even access to healthcare of those who are migrant workers. For some states are giving food to people who do not have ration card of that state, and so on. So if we could make the entitlement question more flexible at this point and think about it, would be very, very useful. Now, so let me come to the specific sector related issues that I would want to, and I've been asked to speak on. First, think about how urban areas need to think about inclusion of informal workers or working class within the cities. First thing that need to be thought about is about housing question. Now, in last 2 to 3 decades, we have not been thinking very succinctly about housing question. Except for a sort of few brief period in UPA regime when Rajiv Awas Yojana was designed, but it met its infantile death, so to say, because even UPA government really did not implement that. And with the NDA government coming, they've set up a new housing program called Prime Minister's Awas Yojana. And the way the Prime Minister's Awas Yojana works is that it only addresses people who have formal address or able to provide address through either Aadhaar card or any of the other identity in the city. And that obviously excludes the entire new migrants. It excludes also the entire seasonal migrants and so on. So there's absolutely nothing about a very large segment of urban population in this program. And hence, once this housing doesn't get addressed, then you are more vulnerable. For example, in the so-called social distancing issue, there were a lot of memes that were going around that everybody, the instruction from the central government was that everybody needs to live in their own house and maintain distance. The people were on the without house or homeless were saying, very good, we will now get housing as a outcome of this pandemic. We do not have adequate night shelters in spite of provision, in spite of the Supreme Court order. The ones that exist are not habitable. Till recently, the government themselves were, or city governments themselves were admitting to the fact that these are not working well. There's higher level of crime or criminal activities in these shelters and so on. And they've been in the better states, we're asking NGO support to run the centers. And so we really have a situation of lack of appropriate housing. Social distance will work in the cities also if there's less crowding. And if you look at the housing data, I was looking at, for say, Ahmedabad city, and we have at least 40% of households in the city on an average which are living in one-room housing, and with an average household size of 5 or so. In certain wards in Ahmedabad and certain localities, there are about 60% of housing, 65% of housing, and this is Ahmedabad. So Mumbai, the situation is going to be even worse, and Mumbai and Delhi, where the densities are much higher. In this situation, to control pandemic through this mechanism is not working. Second is that if such pandemics and public health and hygiene has to be controlled, we need to have regular water supply. So when we talk about housing, I would say housing includes access to water supply and sanitation. And there is no regular water supply, or there is no space to store the water. If water is stored in households, there is also a fear of high risk to malaria. And so on. So there needs to be finally a tap water supply available and in an adequate fashion, and which would require that financing for this is required in the city budget. You cannot just base water supply, and there's been talk about 24/7 water supply, which is metering of water, which would increase the cost of water supply, and is going to have adverse impacts on people who are not going to be able to afford this water. So this pandemic requires a minimum requirement of water supply. There is also a requirement of individual toilets, because sharing of toilets and bathroom makes households in slum communities vulnerable, which means that the whole paradigm of basic services, from shared community toilets and water taps to individual toilets and water supply, is required. Some cities are doing it. In many cities, that's not possible. And so housing requires to go along with this, and that one-size-fits-all housing approach of Prime Minister Awas Yojana would not work. Now, if housing has to be tied with living quarters of workers, for example, there has been efforts about what do we do with housing of the construction workers, and many of them are mobile. What is the approach to that? There could be flexible housing or with approach where housing, prefab housing, etc., which could be constructed and shifted to new construction site. I don't see we have efforts in that. Funds for the Construction Workers Welfare Board could have been utilized for creating such a housing, which is flexible housing. That also we don't see, and we see large amount of funds in many states remaining unutilized. And these days we do see numbers coming out of what are the amount of funds which are there in the system but are not being able to utilize. If housing question is addressed, then the question of need for people to move in the city and transport, because our public transport is another area which is making populations which need to move vulnerable to the virus. So if you're creating cities where you have requirement for public transport which is high, that in recent last 5 to 7 years, what we have done is we have pushed the poor out onto the peripheral housing. And it's not just a story of one city, there are multiple city stories of pushing them out to peripheral locations, in work being available wherever in the city, and they need to commute. What Kanan was saying about rupees 375 per day per worker as a wage, it's highly unlikely to cover the housing and transport costs in the cities, especially in the metro cities. And so if you relook at housing in a different way and have a situation where you have low requirements for transport and people can walk or cycle to some of the places of work. And so the spread of contagious diseases could be controlled as a consequence of that. But instead of doing that, what we are now getting this fancy terminology coming from, largely originating in context of American cities, of what we call transit-oriented development and high-density development around transit corridors. US has American cities have sprawl and very low densities, whereas Indian cities are extremely high density. And to improve living conditions and control the pandemics in some parts of the city, we need to reduce the density and not increase the density. That's population density. And so we have to also change our vocabulary about what we are doing. Today, if you open up any ongoing master plan of a city, or some ones that are being made new, or if you look at the policies of the Ministry of Housing and Urban Affairs, you would find the idea of transit-oriented development mainstream into what the cities should do. And it is another thing that many of this transit-oriented development are actually going to be high real estate enclaves and not inviting urban poor. For example, in Mumbai, I was reading an article which says that some of the small, tiny apartments that are coming up along transit are costing around, which are about 15 to 18 square meter, costing about 50 lakh rupees, and which is the urban poor at the rate of 375 rupees per day per worker's wages going to afford this. And hence we also need to challenge the current discourse which is there on how housing has to be provided for the urban poor. All these new ideas, the neoliberal land market, land value capture related terminologies, we need to relook at them, disaggregate them, and split them to understand what it is that is going on in the cities. The second question on space is with regards to informal work. And today, that is also, for example, street vendors, it's a very, very real issue of having space available for them. So now, at some point, we have a thinking about a street vendors market or the natural markets for the street vendors. And which means that there would be natural market for the is a term which says that there is congregation of such informal activities because there's that economies of scale. Now that congregation is not allowed, and so many of the street vendor markets have been broken up as a response to pandemic now. So individual vendors or vegetable sellers or some of the daily necessity sellers are allowed, but their congregation is not allowed. And so if any of there is a contiguous disease, how are we going to address issues of street vending? Firstly, there is no space, they've been pushed out, markets have been disturbed, even without the pandemic. I fear that pandemic can be taken as an excuse to break up these markets further, and we just need to be aware about it and mounting a campaign for quite some time to come to be able to address space requirement for vendors. And lastly, I want to also raise the issue of what others have said about governance in the cities. As far as welfare issues in the city is concerned, except provision of water supply and drains, everything else has been left to the market. So many states do not have good urban health services. The requirement of hospitals is low. Because as the funding happens through the departments and through the Panchayati Raj, so through the taluka, district taluka and panchayats, urban areas don't have that kind of line item of funding of some of these welfare activities. And there has to be now that funds available to the cities also, because cities also have substantial number of people who are unable to afford some of the services which are market-based services. And lastly, there is, as others have also said, that there is a tendency to centralize, over-centralize decision-making at the state level and at the central level. Urban institutions of governance are almost defunct. Panchayati Raj institutions might be working, but there are no ward committees in most of the cities across India. The ward committees, if they are framed, are dysfunctional, and so there are no institutions for participatory governance at the local level. Further, the funding to those institutions is not there. The decisions about how the funding happens is also centralized. And so the funding is, huge amount of funding is available for, let's say, metro. Let me just give you a comparative number. Central Vista would cost 20,000 crore rupees. In the current budget, that is 2021 budget, 20,000, around 18 or 19,000 rupees crore have been allocated for metro projects by the central government. And you see the kind of priorities that are there for investments in the cities. And there needs to be much larger also discussion about it. And in this, when many of these large metro projects and urban development projects are coming up, there is a need of construction labor. Their housing is also an issue which is unsettled. Unfortunately, sometimes the international funding agencies are making it conditional, their funding conditional to housing of the construction workers, but it's not the democratically elected government that is saying that there has to be housing for the construction workers. And so I have sort of said how the city development should be. And last issue in governance is that currently, and this has increased more so after JNNURM, that there's an export-led urban planning which is completely non-transparent and even now unaccountable. And so decisions are taken and the people of the city do not know what is happening at the city, for the city. The way decisions are taken, for example, informal sector is not allowed in some of the new upscale projects in some of the cities. For example, Ahmedabad riverfront company has said that we are not going to allow any vendors on the riverfront. There would be kiosks which will be leased out, which is people who have some capital to invest in. They are not allowing auto rickshaws or cycle rickshaws or any other non-motorized vehicles on the riverfront. Whereas the Indian reality is completely different. We have a very less percentage of people who are traveling by private vehicles. Buses are also not allowed in some of this new real estate and new development. So I think there is kind of a huge bias that we see in the new programs, and that could be corrected if we had a better governance structure. In governance, last issue, and I think Amita is following me, and we've been discussing about this, is that in cities, we cannot, if spaces have to be made available for the urban poor, for their living and their housing, and for their economic activities, land should be constructed as a social good and not a market good. We need to harvest the use value of land and not exchange value. That would prioritize activities catering to welfare than only market and speculative real estate projects. Thank you.
Thank you, Professor Mahadevia, for highlighting different issues and challenges in the urban spaces and how we can restore by addressing those challenges to revival of the informal sector.